one question before I start. How many of you are using hybrid fillers? Can I see some hands? Hybrids. So, okay, not that much. But as you probably all know, it's becoming more popular every week, every month. You see more posts on Instagram, articles arise on how to use hybrid. So I was actually quite happy that they asked me to give a small talk on layering versus hybrid. Because is hybrid the answer on everything? Well, let's give you the answer already. Of course not. Yeah. Good. So I'm a trainer for MEXS, as a disclosure, and a faculty member of UMA Academy. But before we start talking about hybrid and layering versus hybrid, we first have to understand, of course, is this a bit? We have to understand radius, and we have to understand Bellatero. We cannot understand hybrid without understanding the different products. Yeah? So I will start with this slide, and this is actually the most important one, if you ask me, together with the next slide. And Carolina, you gave a beautiful presentation already, also with some more understanding of how to use the products. But if you talk about hybrid, we're adding hyaluronic acid to our radius. As you maybe know, radius is the product in our clinic that we use most. I think we use, well, 60–70% radius, and the rest is HA. But we have to understand our product, right? So if you talk about the Bellatero range, there are probably two HAs that are used most in the hybrid. It's Bellatero volume, and it's intense. This is how MEXS is telling us how the rheology is. Yeah? When we give training in our academy, first thing that I do with all the hands-on training is that I get the product and inject on all the hands of the doctors so that they can feel the product. You cannot inject something that you have never had in your hands, right? You have to feel the product. And when you feel the product, you understand this. Because intense has 4 pluses on elasticity, right? When you touch it, you can feel the product. It moves all directions, and it will stick on your finger. If you compare that with Bellatero volume, who has, in the laboratory, 3 pluses of elasticity, which I actually do not believe, I think it's much less. But the plasticity is amazing on Bellatero volume. So we have to understand what do we inject and why do we need it. Yeah? As Dr. Carolina explained, if you want projection, of course you use intense. You need the elasticity, you need the projection force, but if you inject more superficially, you want to smooth out tissue, with soft volumization, we want Bellatero volume. Yeah? Okay. Of course, you can also add other products, other HAs to your hybrid, because hybrid, what does it mean? It means best of both worlds. Yeah? So yeah, we can also add our Bellatero Balance to our radius. We can also add Bellatero Revive to your radius, depending on what you want to achieve. But we come to that later. So now we understand the rheology of the HAs maybe a bit better. We're going, I would like to go to radius, because this is for intense, the lifting, volume, smoothing, yeah? So if you talk about radius, there are 2 boxes, right? As Dr. Carolina showed us, the Radius Plus and the classic radius. I mean, the Radius Plus, we have it for 5 years now, I think. Before that, we only had the classic radius, right? So we injected it undiluted, which was sometimes quite painful, so we had to do some anesthesia first. But for nice projection in males, we used it undiluted. Now, the Radius Plus, it's with lidocaine, obviously, but it's powder lidocaine, right? Same as with all the HAs. So you use the undiluted radius with lidocaine in a powder form so that it doesn't affect the rheology. So it's the strongest product that we have. Yeah? The amount of calcium hydroxyapatite, 30%, makes the product really elastic. It's strong, you can project, can give contours. The moment we use classic radias, we have to add some lidocaine to the product. We're adding lidocaine as a liquid. That means we're changing the product. Yeah, it's not a strong product anymore, it's a bit less, but we can still do good things with it. We can still project, we can still give contours. The moment we add more lidocaine and saline to the product, so we're diluting or hyper-diluting the product, it's not a filler anymore. Yeah? It's not a product where you can contour with. You cannot contour a jawline with one-on-one diluted radius. Yeah? So all the characteristics are gone, right? Okay. So to understand radius a bit better, we have to see what it is. So in this syringe, right, there is 30% calcium hydroxyapatite. Only 30%. The rest is just a gel carrier. It's a cellulose gel. And the cellulose gel will disappear in 3 months. And of course, we all know that it promotes collagen, but not just collagen, right? It's a regenerative product. Okay. So this is a really important slide, if you ask me. Because what do we see here? When we inject radius as a filler or to contour or maybe even to volumize in the deep plane, which I love to do, we have 100% augmentation. Yeah, that's understandable. But 30% of the syringe is calcium hydroxyapatite. The other 70% is the cellulose gel, which will degrade in 3 months because of our body's own macrophages. Yeah? That means if you just use radius for cheek augmentation, for example, it will look amazing, to my humble opinion. But after 3 months, sometimes you'll see a drop in result. Yeah? Because of the degradation of the cellulose gel. But if everything works properly, and in most young people it will work properly, because the production process of collagen is still really sufficient, there is enough collagen formation so that there is still 100% augmentation. But there are patients, obviously, that the process of collagen formation is slower, right? We can think about certain patients like postmenopausal patients, for example. Of course, their collagen production is not as sufficient, so it works a bit differently. It goes slower. So that line will never reach the 100%. Yeah? So the augmentation obviously is going down. Yeah? The collagen will go down, and in 2 years, all the calcium hydroxyapatite molecules are gone. Okay. So if we combine the knowledge now that we have, we can understand the mixing process maybe a bit better. If a patient comes to your clinic, it is we, the doctor, who is giving the advice, right? In the Netherlands, I'm from Amsterdam, there are so many new clinics coming. Yeah? Every month there is a new clinic opening. But most of those clinics, they have a certain way of treating their patients. The patient comes, asks for something, and the clinic will do it for you. Yeah? But obviously, this is not the way we should do it, because if the patient comes to you with a certain problem, we are the experts, so we have the solution for them. Yeah? So of course, first we have to think about what is the effect that we're looking for. Yeah? If we want skin quality improvement, then we have to think what are the characteristics in our product that we need. Yeah? We need a product that hydrates. We need a product that produces collagen and maybe elastin. So yes, of course, we need radius for skin quality improvement. So we use a hyperdilution of radius, but we can also use Bellatero Revive, a skin booster. Yeah? For example, if you want to lift the face, yeah, if that is our intended effect, then what is the characteristic of the product we need? We need a product that is really elastic and maybe even really cohesive so that it stays in the place where you inject it. Yeah? So, yeah, of course we need Radius Plus because that is one of the most elastic products. And yes, of course we need Bellatero Intense because it's one of the most elastic HAs. Yeah? So first, before we choose our product, we need to understand what is the effect we want to achieve. Okay? All right. So with our faculty in UMA Academy, we came with a certain protocol. Yeah? And as you can see, it is a kind of a consensus with all the doctors that are in our faculty, because everybody was doing things differently. Yeah? And it's understandable. Yeah? In all the places where Radius is used here, you could also use a hybrid. Yeah? But then, what hybrid? So we'll come to that later. So, of course, if this is what you want to do with just Radius, yeah? If we want to lift something, we need a strong product, so we're using Radius Plus to create the strong scaffold that we need. We can lift the ligaments there. We can even volumize in younger patients. We can give beautiful contours, because even with Radius Plus, we can inject superficially. The question Dr. Schneider got from the audience was about complications, right, and nodules. If you look into literature, my good friend Jonathan Kadouche, he did a literature study, and most complications with Radius were nodules, right? But it's always technique related, because if we inject Radius in areas that are really mobile, because of the mobility, sometimes the product clusters together. But that is also the reason, as also Dr. Schneider showed, we're creating a tunnel with our cannula, inject, when we pull back, we inject, but we should never inject more than, to my humble opinion, 0.1 retrograde. Yeah? Then you create a new tunnel, and you inject retrograde. So, in that case, you spread the product in the tissue, and if there is some movement, the chance of a nodule is much less. Okay. So if we need a bit more forgiving scaffold, yeah, we're using the standard diluted Radius. So we add 0.3 of liquid, the product becomes a bit softer, but we can still inject folds with it, or to lift even with it, but it's more forgiving. Yeah? It's not as strong. So it's, in maybe beginner hands, a bit easier. But then, if we want, like, the skin quality improvement, and we add more liquid, we create a 1-on-1 dilution or a 1-on-2 dilution, it's a liquid, right? And I will show it to you in a small video later. So it's something completely different. So it's not something that you should be afraid of, if you ask me, right? Again, if you use small amounts, you can massage it, there will be almost no problems. The biggest problem is if you dilute it in a way like 1-on-2, 1-on-3, 1-on-4, you have to mix it in between session. Yeah? So you mix it, you inject. When your syringe is empty, you mix it again, you take out more, you inject. Okay? Because if you don't do that, the calcium will fall down, and you will inject pure calcium hydroxyapatite in the last syringe, which can affect definitely. Yeah? Okay, then, if you want to add HA to your Radius, so we're creating a hybrid now, yeah? Then there are more options. So, I think most hybrids nowadays are with Radius and Bellatero volume. Why? Because of most studies that are published. Yeah? Jonathan Kadouche, together with Nabil Fakih, they published a lot, yeah, and I love them. But they're using the product probably a bit different than I do, and it's understandable because most patients that they treat are from the Middle East, Yeah, but we'll come to that later. All their injections are subcutaneous, for example. My injections are definitely not subcutaneous, unless I want to have skin improvement. Yeah? Okay. So if you want to create a hybrid, you can use Radius Plus, and you can add intense or bilateral volume, depending on what you want to achieve. Do you want ligament lifting? Do you want volumizing? Or do you want contouring? Yeah? Intense you use also you can use for contouring. So the moment you mix Radius Plus with intense, it's beautiful for contouring of a jawline, for example. If you want like smoothing the superficial fat compartments, well then obviously we take bilateral volume and you mix that with the calcium hydroxylapatite. Yeah? If you want to have a bit more forgiving hybrid, we can use the standard diluted radius, and you mix this with your intense or volume. But you can even mix it with bilateral balance, especially in the older patients with a really thin skin, right? There is almost no subcutaneous fat. You take your standard diluted radius, you mix that with one syringe of bilateral balance, and you can place like this beautiful sheet of hybrids superficially. Okay. Do we already have the perfect filler? No, we don't, right? We have beautiful products in our portfolio, but what makes a good filler? Yeah? Of course, the product needs to be cohesive, right? We want to inject something, and we want the product to stay in that area. We want a product that is elastic. It needs to be, there should be plasticity. All these things we would love to have in one product. Yeah? And then around those things, there are many other important things. Well, if you talk about one of the most important things is the biointegration, right? So that's also the reason why the hybrid filler is so safe. We know that the bilateral range is the product with the best tissue integration. And then we mix this with calcium hydroxylapatite, which is, to my humble opinion, the safest product on the market for 20 years already. Why? Because we're injecting something that is exactly as it is in our body. Yeah? All the HA we inject, it's not natural HA, right? It's cross-linked. That means it's not the HA as it is in our body. So there is always a reaction of the tissue. But with the bilateral range, the tissue integration is really good, right? There is almost no immune response. With Radius, there is no. So if you combine this, you have a really safe product. So why would we like to mix calcium hydroxylapatite with HA? Yeah? Well, a lot of doctors do this because they see an enhancement of the aesthetic effect. Well, that could be correct, but not in all cases. There is a big difference in ethnicity, for example. Yeah? If you remember the diagram I showed you of Radius with the degradation of the CMC gel, I remember when I started in aesthetic 12 years ago, I was wondering, so why did it produce a product with CMC, with a cellulose gel? Why did they just not add the calcium hydroxylapatite in a hyaluronic acid gel, right? And I found out really fast that it actually was perfect that they did not use calcium hydroxylapatite in a HA gel, because one of the most important reasons I'm using that much Radius is that it doesn't attract water, right? I can lift the face, I can volumize the face in the deep compartments, in young patients, I can contour, and it will not attract water. So it gives sharp definitions. It will not, you don't have to be afraid that the result will change, because what you see is what you get, or a little bit less. Yeah? But in older patients, or if you want to create volume in older patients, yes, you see that drop in results sometimes. And then with adding an HA, you compensate for that, right? So there is, well, you can call it rapid, but in 3 months there is a little drop in results. But when you add your hybrid, you fix this, right? Okay. Also, when you create that scaffold with your calcium oxalapatide, you're prolonging actually the effect of the HA. Okay. And then to even give more skin tightening and more tissue lifting, both product mix can give you amazing results. Yeah. So you know these pictures, right, from the articles that are published by Jonathan and Nabil. So mixing the both products for a lot of doctors makes sense. But my job here is to explain you a little bit that it's not maybe the best thing for all your patients. You should always think, what is it we want to achieve? So we have our HA, and we know our HAs, right? We know exactly what we can do with our product, and we have our radius. And when you know your radius, you know how to handle your product. So what we did in the past, we were layering our products. We did some HA deep. Sometimes we did some HA superficially. We did some radius deep, some radius superficially. We could do it in one session. But now with the hybrid, we can still layer, or we can do it in one. So we can use the product in multiple layers, hybrid in multiple layers, or the different products in the different layers. It has been proven safe, right? They've treated a lot of patients with a long follow-up, and there weren't actually almost no adverse events. One of the biggest group of adverse events was overcorrection. And actually, that's understandable, because you take away one of the biggest pluses of radius, right? With radius, it doesn't attract water. The moment you make a hybrid, it will attract water, so overcorrection will happen. Yeah. Good thing is we can dissolve, also with the hybrid, of course. Yeah. A lot of patients were really satisfied, and it lasted really long. So I think the efficacy definitely can tell us that the hybrid is here to stay. I'm going to show you a video now where I treated the patient with multi-hybrids. Yeah? And I will explain you why I chose to use a hybrid on this patient. Yeah? So as you can see, this is a beautiful lady. She's around 52. And I don't want to create too much roundness in her face. Yeah, she has beautiful bone structure, beautiful gray hair. But the anterior cheek actually was quite nice. Yeah? She just needed a little bit of lift and some skin quality improvements, right, as you can see. So the temple was already treated here, and I'm just treating the mid-face here. So I always start with the same drawing in all my patients. Yeah? So after the drawing, first I decided what product actually, so I'm using the Radius Plus mixed with bilateral volume to use deep here, and I use Radius Plus with Intense for the lateral cheek. Yeah? And after that, I use the Radius with bilateral volume also a bit superficially to smooth out the contour of the midface. And at the end, I did Radius Dilute 1:1 with 1 syringe of bilateral Revive. And that was superficial placement for skin quality improvement, so the subdermal injection technique. Yeah? So to lift, we need a product with elasticity. So that's why I'm using the Intense mixed with Radius Plus for the lateral part, and to smooth and to compensate the volumes in the midface, I'm using the smooth bilateral volume mixed with Radius. Yeah. So I always mark from the ala to the tragus, so it splits the face in two. Yeah. Above the alar tragal line, it's all deep, and below the alar tragal line, it's superficial. Yeah? Because we have bony support above the alar tragal line, so we can inject deep on the periosteum. And I can do that with my radius, I can do it with my HA, but I can definitely also do this with my hybrid. The good thing is, if I would do this with just HA, it will last really long, but it will attract more water. So it becomes rounder. The moment I use a hybrid, it will attract less water, because 50% is radius. Yeah? But the result is still long-lasting. So on the lateral zygoma, I made my first entry point, and my second entry point is on around 4 centimeter, because I'm using short cannulas, 25-38. Yeah? So from the second entry point, I will go periosteal to do the deep medial fat compartment, and of course I will watch out for the angular artery because I'm running in the same layer here. Yeah? Okay, I go to the next video. So this is the product. Yeah. So this is the hybrid. As you can see, there is still elasticity here. Yeah. I can advise you all, touch the product, yeah, before you inject it, just once, because then you understand much better in what layer you should inject. Yeah? So I start from the lateral point. I'm lifting the cheek. This is subcutaneous, right? That's not the layer I want to inject a strong product. So I'm lifting the cheek. I feel a resistance here. Yeah, that's a SMUS layer. You can see the skin pulling in. So 1, 2, 3, click. Yeah, a little bit more pressure, and plop. And I can slide over the periosteum here. Yeah. So I use always the same amount. Yeah, I never inject more than 0.1. Yeah, that's something that we discussed in our clinic. In normal risk areas, a bolus of 0.1. You saw what I injected on my glove. That was 0.1. It's quite a big bolus. And if I need more, I can do more boluses. Yeah. So I inject, and I do a little retrograde. And I remove my hand, as you can see, because I see a lot of doctors injecting with their hand on the cheek, but we work in aesthetics, right? You can see what happens immediately. So remove your hand while injecting, and I do a small retrograde. I go a bit lower, and this is just for projecting the cheek, okay? As you can see, I've injected now maybe 0.2, 0.3, and surely but slowly that cheek is giving more projection, yeah? And the good thing is, because it's a hybrid, it will last really long, but it will not change that much. Yeah? There is definitely water attraction, but much less than, okay. Okay. So then, after I've done the intense with radius, I'm switching to the bilateral volume with radius. So I'm smoothing out the cheek a little bit, superficially. So this is the bilateral volume. The mid-face, the medial cheek was already done. So now I'm smoothing out the contour a little bit with a soft hybrid, right? Because this is radius with bilateral volume. Okay? And then also a little bit on the alotragal line. Obviously, we will not inject superficially above the alotragal line in the medial cheek because it will definitely give edema. And then I use the same entry points to go a 1-on-1 diluted radius mixed with bilateral revive. So 1-on-1, as you understand, means 1 syringe of radius, and you add 1.5 of liquid. So I would always use 0.5 of lidocaine, the rest is saline. So we have 3 milliliters of product. And we add 1 milliliter of bilateral revive that really gives nice hydration. So we have 4 milliliter in total, 2 milliliter per side. And as you can see here, this is almost a liquid. Yeah? So you're injecting something that is not elastic anymore. It has some viscosity because of the HA gel that was injected. But this is really forgivable. This hybrid, you can inject really superficially. You can use it in all different kinds of skin types. And I love to use this. And I also use just 1-on-1 diluted radius, but that extra syringe of revive really does something. Okay. So this is some results, really natural result. And because we used hybrid, it's not that round, yeah? And I'll show you a few more results of how I treated my patients. This is a patient that I'm treating for 4 years now. And it's not just hybrid, yes? But I did definitely used, because of her age, and you can see how she came in, she was a smoker, she quit smoking. If I would do this with just Radius, her result would diminish in 3 months, yeah? So of course, I did the superficial injections for skin quality improvement many times in 4 years, and I added a few times some Revive, but also in the deep planes, there was hybrid injected, so Radius Plus with bilateral volume, yeah? But this is not just these older patients that can benefit from hybrid, yeah? Also, this young girl had a hybrid treatment. She came to me because she was a lawyer, but she was 26, but everybody thought she was 17 or 18, so she wanted to look more mature. So with a mix of Radius and Intense, I created a more jawline and more chin. Yeah? So now I'm going to show you some pictures from the study from Jonathan and Nabil Faki. Yeah? To make you feel and to make you hopefully understand that hybrid is not for everybody, yeah? Because they had beautiful results. I mean, I love the results they showed, yeah? But look at the amounts. Relatively a lot, 4 or 5 milliliters per site, easy, yeah? If I would treat my patients in Amsterdam exactly the same, because these are all subcutaneous injections, I can probably close the clinic within a year. Because these patients, they love the full face, right? And not the treatment full face, but a full face, like not overfilled, but they love the round faces. Well, with a hybrid, you will definitely get a round face if you do the one-on-one mix, yeah? So yes, they're long-lasting results, but only subcutaneous use of hybrid, to my humble opinion, is not the way to go to. Yeah? So you can see again, so 1, 2, 3, only almost 4 milliliter per site. So my advice to you is observe your patient. Yeah? Listen what he or she wants to achieve. Then go back to the slide I showed you. What is the intended effect we need for that? What kind of product characteristic do we need to get to that result? And then decide whether hybrid is the product to go to. So what is the treatment goal? Do we need HA for longer lasting volume? Or can we use HA for extra volume? For example, the older lady that has the masseter hypertrophy and there's a lot of volume loss in the lateral cheek fat compartment, I love to use a hybrid there. Yeah? So I want to use that extra volume I get with my water retention for the lateral part. But in my younger patients, I just want definition. I don't want that. Yeah? Then think of, do you want a rounder result or not? Okay? And also really important question, who is this patient? Yeah? What about age? Is she postmenopausal? Is Radius the product to go to, or do we need some extra HA to mix this? Think about the ethnic background. Yeah? Is that result that that patient is looking for, that natural result, is that matching with your ideas of a natural result? Yeah? And think about the skin quality. Okay. I think we're exactly on time for lunch, right?
Not yet.
Not yet? Okay, no, but I mean, it's almost 1, I think. So thank you for listening, and remember, knowledge is beautiful.
Thank you, Job. I think that before going for lunch, we need to answer some questions from the audience. So take a seat. Thank you for your great presentation. I'm happy to have you here in Italy to discuss your experience with hybrid. But the first question is a little bit tricky. So As there are many publications dealing only with RADS plus Belotero range, would you consider another HA?
Oh, yeah. Well, I got that question more often. And I have to be honest, right? Of course, you have to understand your products. Yeah? So I'm using the Belotero range for 13 years now. I know exactly what to expect. Yeah? Radius has been proven safe. Yeah? So the moment you mix two products, you have to completely understand both products. And I would lie if probably we could not mix it with a different HA, but if you do that, I don't think you can knock on MEXS' door if you have a problem. Yeah? So if you know your HA, if you know your radius, if the HA is safe that you use, radius definitely is. So it should be possible, but maybe not advisable.
Another question which is directly related to a competitor. I don't want to mention the name, but you perfectly know what I mean. So you know there is a pre-mixed product on the market. And the reason why you don't use this pre-mixed product is related only to the lack of tailoring, or are there any other reason, for example, safety, quality, purity, efficacy of the product?
Yeah. I mean, the secret of radius is that perfect particle, that perfect microsphere that is in the syringe, right? Because of that perfect round microsphere with the perfect size, it's not giving any problems. The KH that is mixed in competitor products, there is actually not that much research on it. Yeah? We have so many beautiful histology studies on radius that it is really one of the safest products on the market. But the most important reason is definitely I want to personalize my hybrid. I want to personalize my radius. So sometimes I use it pure, sometimes I add a little bit of saline, sometimes I add some HA. What HA? And I can completely build like 30 different products with, for personalization of my treatment plan with my patient. Yeah.
Other two questions. So, it's more related to the physicochemical characteristics. When you mix the two products, are you sure that you are not breaking the cross-linking of the hyaluronic acid?
I should be, I know, people know that I'm always really honest. Actually, I don't really know. Probably not, because it depends how you mix probably, but the chemical bonding is relatively strong. So with just mixing through a Luerlock connector, you probably will not be able to change the chemical bonds with the BDE. So I would not be afraid, but that's a good question actually, that I cannot perfectly answer. I'm sorry for that.
So last questions. I think the last one, and then we will go for lunch, as I think you are hungry. So, which filler, hybrid filler combination and indications, both, which combination, which indication are you suggesting to start with for a doctor who wants to gain confidence with the hybrid filler in the safest way?
Yeah. Well, there are a few answers on this. Of course, the one-on-one diluted radius with Belotero Revive is a relatively safe procedure. Yeah? But of course, you have to feel comfortable in treating a face. But you're injecting something that is almost a liquid. If you can inject, if you are able to inject really securely and focused, just small aliquots retrograde, you do a good massage, you should be okay. Also, the standard diluted radius with Belotero volume, and you inject this, for example, in the deeper plane lateral, the lateral cheek, as relatively a low risk profile. This could also be a good way of learning your a hybrid, and then a bit stronger hybrid. So not just for the skin quality improvements. So I would say standard radius with bilateral volume, but always understand that the moment you add bilateral volume, you're adding an HA that attracts a lot of water. Yeah. So always do an undercorrection, even with a hybrid.